And you are live. Please proceed when you're ready.
Hi, everyone. It's 5:30, so we're going to get started with this evening's presentation. I am Andrew Shapiro, the Environmental Contamination Administrator for the town of Nantucket, and I'm going to introduce our presentation and our speaker, and then I'm going to go on mute until we take comments and questions at the very end. So first, thank you for everyone who has showed up to our past two lectures on PFAS on Nantucket. I'm excited to have a third presentation scheduled for this evening. This one is going to be a little bit different in that we are going to be zooming in on Nantucket specific. So previously we have had great speakers who have told us broadly about PFAS exposures and PFAS health effects. For this one, we're going to zoom into a project where we collected some actual PFAS data on the island. So I'll just introduce the project quickly and our speaker, and then I will turn it over to Dr. DeVries. So as you all probably know, PFAS are compounds that can accumulate in the environment and are commonly found in the groundwater on Nantucket. Um, this presentation will highlight methods and key findings from a summer project assessing PFAS in Nantucket's beaches, harbors, and ponds. And we will also discuss potential health risks associated with recreational exposures. So our speaker for this evening is Dr. Rebecca DeVries, who is an environmental health scientist at Eastern Research Group. She has extensive experience leading and supporting studies on PFAS exposures and health risks for state and federal agencies, as well as local agencies. Her work includes assessing PFAS in surface water and fish in multiple states, including Massachusetts, as well as conducting community-based exposure and health studies in areas affected by contaminated drinking water. Dr. DeVries holds a PhD and a master's degree in epidemiology and a bachelor's in environmental science. So, as I said before, we'll take questions and comments at the very end. So, I am going to turn it over to Dr. DeVries. Dr. DeVries, please take it away.
Great. Thank you, Andrew. Can you hear me okay?
Yep, sounds great.
Great. Thank you, everybody, for joining, and thank you, Andrew, for that warm introduction. My name is Rebecca DeVries, and as Andrew said, I work at Eastern Research Group, or ERG. Our ERG team was hired by the town to support a study that we conducted this past summer to assess the presence of PFAS in Nantucket's beaches, harbors, and ponds, particularly in areas that are used for recreation. And today I'm going to provide an overview of this work. So to begin, I'll step through with a quick roadmap of what I plan to cover here. I'm going to start with some brief background on what PFAS are and how they can get into the surface water, and that's just to make sure that we're all starting from the same place. Then I'll talk about why the town conducted this study and how we did it. Next, I'll walk through what we found in the surface water and the foam samples that we collected from beaches, harbors, and ponds across the island. And finally, I'll explain what these findings mean for recreational water use on the island and how they were evaluated from a public health perspective. I do want to pause here for one moment and share some important takeaways up front, just to ease any concerns until we get to that part of the presentation. Just to say, overall, the PFAS results from this study did confirm that Nantucket's recreational waters are safe for swimming and other activities, though we did identify shoreline foam as a potential source of PFAS exposure that people should avoid. All right, so this first section of the presentation, I'll provide a bit of background to set the stage. And we'll begin with what are PFAS. PFAS are a large group of human-made chemicals that have been used for many years for their water, grease, and stain-resistant properties in consumer products and industrial applications. They can be found in various items, such as non-stick cookware, waterproof or stain-resistant carpets, clothing, and upholstery, and certain types of firefighting foam. Because of their widespread use, they can pose a risk of exposure through the air that we breathe, the water we drink or swim in, the soil we grow food in or our children play in, the food we eat, and our use of certain consumer products. Importantly, PFAS also break down very slowly, meaning that they can persist in the environment, and with repeated exposure, they can build up in the human body over time. Because of their widespread use, their persistence, their potential for exposure, and links to adverse health effects, PFAS have become an important focus of environmental and public health research. Now, because this presentation is going to focus on PFAS in beaches, harbors, and ponds, I'll just spend a little bit of time here talking about some of the ways that PFAS can get into surface water. One important note up front, though, is that this project didn't seek to attribute PFAS to any particular sources. Instead, our goal here was to characterize PFAS in these recreational waters and assess the potential for risk. With that said, for some background, PFAS can find their way into ponds, harbors, and coastal waters in a number of different ways. For example, PFAS can move with contaminated groundwater into surface water. Rain or snow melt can carry PFAS contamination from roads and other surfaces into nearby waters. PFAS can be released from landfills. PFAS can be discharged from septic systems, wastewater treatment plants, or industrial sources. And they can also be released into the air, either from a local or distant source, and then deposited onto the water. Once in the surface water, PFAS can accumulate at the water's surface and then become further concentrated in foam. So with that background in mind, why did we do this study? As I mentioned on the previous slide, PFAS can end up in recreational waters and surface foam. This then creates an opportunity for exposure. This can be through swimming in the water or perhaps among children playing in the foam along the shoreline of a water body. As you all very well know, Nantucket's beaches, harbors, and even some ponds are widely used for swimming and other outdoor recreation, both by residents and visitors. Before this study, there was limited local data on PFAS levels in these waters and in foam on them to assess the potential risks. Because of all this, the town initiated this study to help fill some of those gaps, inform public health guidance and communication, and support the safe use of Nantucket's natural resources. So what were our overall goals, and when did this work take place? Well, our first goal was to measure PFAS levels in surface water and any visible shoreline foam at coastal beaches, harbors, and inland ponds across Nantucket. We included foam as part of this work, recognizing that it can concentrate in PFAS and potentially result in higher exposures. Our second goal was to then use these data to better understand what the findings mean from a public health perspective, particularly for people who swim or recreate in these waters. The image shown on this slide now presents the overall timeline for this work. In June, we developed a sampling and analysis plan, which is a detailed document describing exactly how and where the samples would be collected and how they would be analyzed by the lab. This document is available on the town's PFAS website for anyone here who's interested in more of that detail. We'll cover some of it briefly. We then collected a first round of samples in July, followed by a second round of samples at the same locations in August. And now in January, we're here together to share an overview of key findings with you. I will say more detailed analyses and some additional findings beyond what we'll cover here are documented in greater detail in a technical report, which is also now available on the town's website. Okay, so let's move into some methods. In this part of the presentation, I'll describe at a high level how we collected and analyzed the samples. Again, if you want to know more about how we did that and why, I would refer you to a copy of our sampling and analysis plan on the town's website, or I can answer questions at the end of this presentation. The map that's shown on this slide presents where we collected samples as part of this study. In total, we collected surface water samples from 27 different locations. That includes 16 coastal beaches or harbors, and those are shown as the blue points on the map, 3 inland ponds, which are shown as the orange points, and 2 locations off the north coast of the island that served as background locations. You can see those as the yellow points. We included those nearshore background sites to help us further understand PFAS levels a little further out into the coastal waters and away from any potential shoreline influences. I'll also just mention here that most of these locations are sites that the town already monitors during the summer as part of its routine weekly bacterial beach monitoring program. In other words, these are already well-established recreational areas where people are known to swim, wade, or spend time in the water, at least a majority of them. As a reminder, the goal of this effort was to focus on realistic recreational exposures rather than trying to sample everywhere on the island. As for foam, we collect samples at the same time as the surface water samples wherever we saw enough foam on the shoreline to do so. I'll get into this in a little more detail later, but the lab requires a certain amount of liquid that comes from a much larger volume of collapsed foam to run their PFAS analysis. We were only able to collect foam samples where there was enough material present at the time that we were collecting the samples to meet that requirement. For this study, that occurred at 2 locations when we were out there. Sasachika Pond, which is shown as location S3 on this map on the east coast, and Matticat Harbor, which is shown as location N8 on the west coast. So how did we collect the samples? We collected the surface samples at all locations by wading into the water at the beach and pond locations or by boat for the nearshore locations. We collected the samples by dipping bottles 1 to 1.5 feet or so below the surface, and we did so using a method that avoids collecting the very top surface layer of the water. We did that intentionally because PFAS can sometimes be more concentrated at that surface, and we wanted to collect samples that represent typical recreational exposures. We collected the surface water directly into bottles that were provided by the lab, bottles that are known to be PFAS-free, and that look like those that are shown in the photo on this slide. We then packed those samples in coolers on ice and stored them for shipment to the lab. The methods that we use generally followed guidance from the Massachusetts Department of Public Health, or DPH, along with some additional measures that we implemented to further minimize the potential for PFAS cross-contamination. Basically, throughout our entire sample collection process, we took a number of different precautions to ensure that we weren't inadvertently introducing PFAS contamination into the samples. Moving on to foam. Foam sampling is quite different from surface water sampling. At the locations that we visited, surface water is obviously always there. Foam, on the other hand, is highly variable. Sometimes it's there and sometimes it's not. And that depends on a number of different factors, like wind and other weather conditions, wave action, the amount of more organic material in the water, and so on. Because of this variability, we only collected foam when there was enough, we only could collect foam when there was enough material present to do so. Going back to what I mentioned earlier, the laboratory actually analyzes the liquid portion of the foam, and they require about 500 milliliters of that liquid for their analysis. That's about the amount that would fill one of the bottles that I just showed you on the previous slide. To get that amount of liquid, you need a much larger volume of foam. But the exact amount of foam that you need isn't perfectly known, and it can vary quite a bit from one location to another and from one time to another. In some way, we basically had to estimate or take our best guess at how much foam we needed and could reasonably collect to get enough liquid for the analysis. During our sampling events, we only observed enough foam to get that quantity at 2 locations. At those 2 locations, we aimed to fill 3 to 4 1-gallon bags of foam. We then allowed that foam to sit in the bags and collapse over a period of about 24 hours. And we did that so we could separate out the liquid portion. We then transferred that liquid from the collapsed foam, which is sometimes referred to as foamate, into sample bottles for analysis. Importantly, I do want to mention here that this is still a relatively new area of study. Our sample collection methods, though, did follow recommendations that we found from other state agencies. such as the Michigan's Department of Environment, Great Lakes, and Energy, and some methods that we found documented in the peer-reviewed scientific literature. Let me show you what this looks like. I think photos might help a little here. The photo on the left side of the screen shows foam along the shoreline of Sasachica Pond during our July sampling event. That's what the foam looked like when we arrived at the pond, and that's the foam that we collected. The photo in the middle shows the foam immediately after it was collected from the pond and was placed into 1-gallon bags. In this case, we filled 3 1-gallon bags of the foam. The photo on the right side of the screen shows the foam sitting in those same bags, but about 10 hours later. And what you can see is the liquid portion beginning to separate out at the bottom of the bag. Continuing on, the photo on the left side of this slide shows that same foam, but 24 hours after it was collected, still resting in those bags in a cooler on ice. The photo in the middle also shows the foam after 24 hours, and you can see that most of it had collapsed at this point. The small amount of liquid in the bottom of each bag is what we collected for analysis. The photo on the right side of the screen shows that liquid after it was poured into a sample bottle. You'll probably notice that unfortunately this bottle was not filled to the top for a full 500 milliliters. While this did introduce some uncertainty around interpretation of the analytical results, which I'll talk about in a moment, the lab was still able to analyze them with the preferred method. As for laboratory analysis, we sent all of the samples to a commercial laboratory for PFAS testing. Specifically, we used PACE Analytical Services, which is located in East Longmeadow, Massachusetts. All of the samples were analyzed for 40 different PFAS using EPA method 1633A. This is a validated and commonly used method for detecting and measuring PFAS in environmental samples, and it includes a number of built-in quality control measures to help ensure the accuracy and consistency of the results. We also included a range of quality control checks in the field to further ensure that our data were reliable. This included collecting duplicate samples to check the precision and consistency of our results, as well as blank samples to confirm that we did not introduce contamination through our sample collection methods or through any of the materials that we used, such as those 1-gallon bags that we used to collect the foam. The photo shown here is one of our field team members preparing a field blank sample. The good news is that overall, all of these checks showed that the sampling and analytical methods did perform as intended. I did intentionally keep this slide at a very high level for now, but I'm happy to provide more detail at the end if anyone has questions on how we collected these samples or why, or again, you can refer to our report on the town's website. Okay, with that, I'm now going to move into our study results. I'll start with surface water, and then I'll talk about what we found in shoreline foam. For surface water, we detected PFAS at 13 of the 21 locations that we tested. You can see where on the map that I've shown on this slide. Each point on this map represents a single sampling location. The points that are in gray are locations where no PFAS were detected in surface water during either of the 2 sampling events. The points that are shown in red are locations where at least 1 PFAS compound was detected at least one of the 2 sampling events. As you'll see in that figure, detections occurred at some of the harbors, at some of the downtown beaches, at the inland ponds, and at some of the locations along the south and east coasts of the island. In contrast, you'll also see several locations, including some on the North Shore area beaches and the 2 nearshore background sites where no PFAS were detected. Importantly, even at locations where PFAS were detected, the measured concentrations were low, and they were below Massachusetts health-based guidelines for recreational waters, which I'll show just a little bit later in the presentation. Let's talk a little bit about what those concentrations looked like. The table on the right side of this screen lists all of the PFAS that were detected in at least one surface water sample. The column in the middle of the table tells you the number of times that each PFAS was detected, and the column on the right tells you the maximum detected concentration across all samples. As you can see, PFOA, PFBA, and PFOS were detected most often. Each of them were found in about a third of the samples. The other PFAS shown in this table were detected less often, generally in about 1/5 or fewer of the samples. Overall, most of the detected PFAS had relatively low maximum concentrations, which is consistent with findings from other studies of PFAS in coastal waters. There was, however, one notable exception that I want to mention for a compound called PFPEA. That higher PFPEA result came from a sample that we collected at Sconset Beach during our first round of sampling in July. It was unique. It was different from the other samples we collected during that round for a number of different reasons, one of which was the presence of a large amount of red algae in the sample, which was basically unavoidable when we were collecting the samples. Because of that difference and the unusual result that we got back from the lab, we decided to resample this location about 2 weeks later, and then again as part of our August sampling event. PFPA was not detected in either of those follow-up samples. If we excluded this anomalous result from our data set, which we didn't do here to promote full transparency, the maximum PFPA concentration that you would have seen in this table would have been about 1.5 nanograms per liter. We also explored the data for different types of patterns. In this slide, I'm going to compare PFAS results measured at the 16 coastal beaches and harbors to PFAS results measured at the 3 inland ponds that we included in the study. The figure on the right side of this screen compares how often different PFAS were detected in the 2 different types of water bodies. The blue bars show how often PFAS were detected in samples collected at coastal beaches and harbors. The gray bars show how often each PFAS was detected in the ponds. The higher or the taller the bar is, the more frequently that PFAS was detected. So one clear pattern that emerges here is that inland ponds, shown in those taller grayer bars, tended to have more PFAS detections, and they were in general at slightly higher concentrations compared to the coastal sites, which you see in those shorter blue bars. We also found that several PFAS were not detected at all at the coastal sites, but were detected in the inland ponds. These findings aren't unexpected. Inland ponds tend to have less mixing and dilution than coastal waters, and they may be closer to more localized PFAS sources, which can contribute to higher or more frequent detections. Coastal waters, on the other hand, experience constant mixing and flushing, which tends to dilute contaminants. In fact, many of the coastal samples in this study had no PFAS detected at all, and when those PFAS were detected, they were at quite low levels. I do want to say here again, even in those inland ponds, though, where we're seeing higher frequency of detect and slightly higher concentrations, all of the measured PFAS concentrations were below Massachusetts health-based guidelines for recreational waters. Changing gears, let's talk a little bit about foam. As I've mentioned a few times now, we observed shoreline foam at 2 locations during our field sampling events, Sasachika Pond and Mattakit Harbor. Those are the only sites where there was enough foam present to allow sampling. And you can see photos of what the foam looked like at those 2 locations on this slide for the August sampling event. Somewhat unexpectedly, we observed foam and were able to collect samples at both of these locations during both sampling rounds. So in both July and in August, these are the only locations where we saw enough foam to collect a sample. As far as the results go, our results showed that multiple PFAS were found in foam at both of the sampled locations and at substantially higher levels than in the surrounding surface water. In total, we detected 21 different PFAS compounds in the foam with concentrations that were often several orders of magnitude higher than what we measured in surface water from the same location. I will say, while not every individual foam result can be interpreted with high precision, and I'm going to come back to that point in a bit, the overall pattern in the data is clear. The PFAS concentrations are higher in foam than in surface water. These findings are consistent with several other published studies that have looked at PFAS in natural surface water foam, including a study that was conducted on Lake Michigan, a study on some rivers in Wisconsin, and a study in North Carolina on the Cape Fear estuary. For anyone interested in some of that broader context, we do have a summary of results from those studies included in an appendix to our report. Now let's take a little bit of a closer look at the actual data. The table on this slide provides a high-level overview of what we found from these 4 samples. It shows the 4 sampling locations in the first column, followed by the sampling round, and then the number of PFAS detected at that location and at that time, or during that sampling round. The table also shows the range of PFAS concentrations detected across all compounds, and then in the very last column, lists the PFAS that were present at the highest concentrations. So, for example, the first row in this table shows that at Sasachica Pond in July, we detected 16 different PFAS in the foam sample, with concentrations ranging from less than 10 nanograms per liter to about 30,000 nanograms per liter. In that sample, PFOS, PFNA, PFOA, and PFDA were present at the highest concentrations. Some key takeaways from the data. As I said before, overall, 21 different PFAS were detected in foam across the 4 samples. As you can see in the table here, the PFAS concentrations in foam were much higher than those measured in surface water, and in some cases, substantially higher. The PFAS levels varied by location and sampling round, though similar PFAS were consistently dominant. You can see in that table PFOS, PFOA, and PFNA, also PFDA, keep popping up. And across all 4 samples, PFOS was consistently measured at the highest levels. This is also consistent with some of the other studies that I just mentioned. I want to take a moment to pause here and note again that sampling and analyzing natural surface water foam is a relatively new and evolving area of study. Many of the foam results in this data set were qualified or flagged by the laboratory as not having met all of their quality assurance criteria. Most of those qualifiers are tied to the fact that some of the lab's extracted internal standards were outside of their acceptance criteria, and that was largely due to there not being enough volume in the sample. Basically, they didn't have enough liquid to analyze. As I explained, we tried to collect enough foam to obtain 500 milliliters of liquid when that foam collapsed, but actually none of our samples had that amount. The qualifications also reflect some of the analytical challenges due to the presence of natural debris like small plant material that was in the liquid we sent to the lab for analysis. That said, even with these limitations and data qualifiers, the overall finding, I would say, is pretty clear and consistent. PFAS concentrations in foam are much higher than in the surrounding surface water, even if those exact concentrations aren't known. Now let's look at how surface water and foam compare side by side. I think I probably made this point clear by now, but overall, PFAS concentrations in foam were higher than surface water. And several PFAS that were detected in foam were not detected at all in paired surface water samples. You can see an example of this in the figure that I'm showing on this slide now. This figure shows results from paired samples, meaning foam and surface water that were collected at the same location and at the same time. In this case, I'm showing data from Sasachica Pond in August. The bars show how much PFAS was measured. The red bars represent foam samples, and the blue bars represent surface water sample results. All of the results are shown on the log scale, which don't worry about too much. It simply means that the scale is adjusted so we can clearly show very large differences on the same graph. You don't need to focus on the exact numbers here, but basically the taller the bar, the higher the concentration. And with that in mind, you can see very clearly that the PFAS concentrations in foam were far higher than in surface water. Across the board, those red bars representing foam are taller than the blue bars representing surface water. Again, this is not surprising, and this reflects the tendency of PFAS to accumulate at the water surface and then concentrate in foam. With those results in mind, I'm now going to shift to what these findings mean from a public health perspective. And I'll start with a quick explanation of how the results were interpreted. For surface water, we compared the measured PFAS concentration to health-based guidance developed by the Massachusetts Department of Public Health, or DPH, specific to bathing beaches. For foam, it's a bit different. There are currently no health-based guidelines for PFAS in foam, and foam isn't really a standard exposure medium in risk assessment. So rather than making a quantitative risk comparison for foam, we interpreted the foam results qualitatively. We looked at the patterns, we looked at the concentrations relative to surface water, and we looked at how those concentrations compared to what has been reported in other studies. Starting with surface water, in May of 2024, the Massachusetts DPH published a document titled Operational Guidance for Bathing Beaches at PFAS-Impacted Water Bodies. This is a guidance that is specific to surface water used for recreation, and it provides a clear framework for deciding when follow-up or additional evaluation is needed. The guidance includes an initial screening value of 20 nanograms per liter, which is applicable to 8 PFAS. These are the PFAS for which there is sufficient toxicology information available now to develop health-based benchmarks. Those PFAS are listed on the slide, and they include compounds like PFOS, PFOA, and PFOA. Importantly, this screening value is designed to be protective of frequent users of bathing beaches, including more vulnerable populations such as children, who may swim or wade in these waters repeatedly over the summer. Under this guidance, if levels for each of these PFAS individually are below 20 nanograms per liter, no action is required. On the flip side, if concentrations for any of these 8 PFAS are above 20 nanograms per liter, the guidance recommends collecting an additional confirmatory sample. In cases where you do collect that confirmatory sample, you then compare the higher of the results to these evaluation recommendations. At concentrations between greater than 20 and up to 90 nanograms per liter, the guidance indicates that no swimming restrictions are needed. The water is considered safe in terms of PFAS. If concentrations fall between greater than 90 and up to 500 nanograms per liter, DPH recommends a beach-specific evaluation to determine whether any restrictions are appropriate. And finally, at concentrations over 500 nanograms per liter, the guidance recommends that swimming be prohibited entirely. This tiered approach is useful. It allows public health officials to respond based on measured PFAS levels and potential exposure, and it's what we use to contextualize the results from this study. Now I'll show you how the surface water results that we got in Nantucket compare to that health-based guidance. Each point on this figure represents a measured PFAS concentration in surface water. Points that are filled in, so the black dots on here, represent detected concentrations, and points that are shown as empty circles are cases where PFAS were not detected. And we've included them here in this figure at the lowest level that the lab could reliably measure, or what's called the detection limit. The vertical line on the right side of the figure shows that initial 20 nanograms per liter screening level that's recommended by DPH. And what you'll see in this figure is that all of the surface water PFAS levels were well below DPH's initial screening value. Based on the agency's guidance, that suggests that PFAS levels in these recreational waters do not pose a health concern for swimming or other recreational activities. I should also note here that there were a few other PFAS that were detected that don't have health-based screening values, so they're not in the 8 listed here, such as PFOSA and PFHPA. These were detected in surface water, but at very low levels, just above the laboratory detection limit. and these low-level detections are not expected to pose a risk to the public health. I also want to call out that one compound again, PFPEA, which was detected at one location, Sconset Beach, at that higher concentration during our July sampling event. Again, as I mentioned earlier, because of that anomalous result, we resampled the location twice, and PFPA was not detected in either of the follow-up samples. So we do not expect that this poses a concern to public health. Okay, let's turn to how we evaluated the foam results. Unlike surface water, there are currently no health-based comparisons for PFAS in natural surface water foams, like that which we collected along the shoreline of the water bodies. Foam is not a standard exposure medium, and methods for sampling and analysis are still developing. Because of that, we could not interpret the foam results by comparing them to a numeric benchmark, and instead we evaluated them qualitatively. As I showed you earlier, our results, which are based on 4 samples, show that foam contains far higher levels of PFAS than surface water. So out of an abundance of caution, the Nantucket Health and Human Services Department issued a public health advisory in August of 2025. You can see a screenshot of that on this slide here. That advisory has a number of recommendations. The advisory recommends that people avoid swallowing surface water foam, such as that observed at Sasachika Pond and Mattocket Harbor in this study. If someone does come in contact with foam, the advisory recommends rinsing off with fresh water as soon as possible. It also recommends supervising children around the foam, since children may be more likely to touch or play with it and could accidentally ingest it. And finally, the advisory also recommends keeping pets away from the foam. If a pet does come in contact with foam, they should be rinsed off with fresh water to prevent ingestion. This advisory, of course, only applies to foam, and it doesn't change the guidance for swimming or other recreational activities in surface water. With that all in mind, including what we found and how the results were interpreted from a public health perspective, I'm going to close with some key conclusions from this study. For key takeaways, first, PFAS were detected in some of Nantucket's recreational surface waters, but at generally low levels, and all at levels that were well below Massachusetts health-based guidelines for bathing beaches. Based on these results, swimming and other recreational activities that involve direct contact with surface water are not expected to pose a health risk. Second, PFAS concentrations in shoreline foam were much higher than in surface water. Because of this, and in the absence of health-based guidelines for foam, the Nantucket Department of Health and Human Services issued a precautionary advisory to avoid contact with foam. Together, these findings provide a strong baseline for Nantucket and will help guide future monitoring and public health communication. Of course, as with any environmental study, there are a number of important limitations to keep in mind related to those key takeaways. First, this sampling represents a snapshot in time, and it may not capture all conditions. Conditions can vary, and the results that we have here reflect what we observed during a summer sampling period when we were there in July and August of this year. Second, foam and sampling analysis is still a developing area of science. This introduces some uncertainty into how the results can be interpreted. And finally, while we analyzed 40 different PFAS using the most robust EPA-validated method currently available, there are many more PFAS used globally that weren't included in this analysis. Even with those limitations, and based on all that we learned from this study, we have a number of recommendations moving forward. First, we recommend continuing to monitor surface water and shoreline foam approximately every 5 years. This will help confirm that conditions and therefore risk haven't changed over time. Second, we recommend continuing to share results transparently with the community, as the town has done with this project, through publishing findings on the town's website and providing updates at local Board of Health meetings and meetings like this one. And finally, as scientific methods improve, as they do, and guidance continues to evolve, as it does, we recommend revisiting the sampling approaches and interpretations of these types of data as appropriate. For anyone that's interested in more detail, I do want to remind you just one more time that the town's PFAS webpage does include additional materials related to this effort. You can find a copy of our sampling and analysis plan there, as well as our detailed project summary report. That does go into some analyses that I was not able to cover here today. And before we wrap up, I want to take a moment to acknowledge the many people who contributed to this work. Thank you to the Nantucket Health and Human Services Department and the town of Nantucket for their leadership and collaboration throughout this project. Also, thank you for letting us tag along on your routine bacterial beach sampling to collect samples for this project. I also want to thank the PACE analytical team as well as our ERG team, who collectively supported the sample collection, analysis, and data review. And finally, I also want to thank all of you, everyone that's here on the line, for your time and attention this evening. I really appreciate the opportunity to share these findings directly with you and hope you'll take a look at our report. And with that, Andrew, I'll pass it back to you so we can open it up for some questions. Thank you.
Thank you, Dr. DeVries, for the great presentation. Yeah, happy to open it up for questions and comments. Thanks for holding your questions till the end. So if you want to use the Zoom feature to raise your hand, I will be able to unmute you, and then feel free to take it away. Okay, I have a question from Mary Beck. Mary, I'm going to allow you to talk. And Mary, you may have to unmute yourself.
I'm a resident in Quidnets and on Sacajah Pond, which the family uses for recreation. And the testing did get my attention. And I'm wondering, in the 5-year plan, why in these, what I would call hot spots, would there not be testing for the next few years that might adjust the findings or make one be aberrant compared to other findings? And I wonder why there'll be 5 years before it will be tested again. What was the decision on that? Is it a cost thing? Is it something that maybe the Quidnet Squam Association would do as a community to pay for that study? Or what would be any recommendations that you might have?
Thank you, Mary, for the question. I can take that one. So going into this program, we were open to sampling more frequently. And so we established in our sampling and analysis plan that if we did have exceedances of the state's recreational beach standards, that we would sample more frequently. And because we didn't get any exceedances of those standards, we do want to continue monitoring it, but there was nothing that was particularly alarming in the surface water. And your question about could we have missed the contamination? It's of course possible, but we did sample twice, so that does give us a little bit more confidence. Mary, I have been talking with other folks in your neighborhood, and particularly the Quidnet Squam Association. So open to hearing your ideas and the association's ideas. So please feel free to keep in touch.
But you will be continuing your annual quality testing, just not PFA testing, but general monitoring as you have for many years?
Yes, that's correct.
Okay. Thank you.
Thank you. Okay, any other questions? I see Bruce Mandel with their hand up. I'm gonna allow you to talk. Bruce, go ahead. You may have to unmute yourself.
Thank you very much. I have a couple of quick questions. We're out in Mattocket on the West End, and we're very interested in the PFAS that is apparently coming from the unlined cell at the landfill, where unknowingly we dumped decades worth of PFAS into the landfill, and it's leaching into the groundwater and our drinking water wells. Many of the wells that have been tested in Mattocket have detected elements of PFAS. And we do have over 30 established sampling wells spread out through Mattocket. They've been there for years. They're GIS located and whatnot. And I'm wondering why they weren't included in this study, since we know that those wells and the drinking water has PFAS in it. Wouldn't that have been a good element to include in this study, or are you planning on doing that in a subsequent study? And it's especially concerning because between these drinking water wells and the online landfill cell is Long Pond, one of our great ponds. And I noticed that you didn't do any sampling in there. So could you update us on that, please?
Sure. Thanks for the question. So first, this is a study focused on PFAS in recreational bodies of water. The question about wells in Mattocket is a good one, and many wells in Mattocket have been impacted. There's an ongoing evaluation of potential nature and extent of the landfill contamination. But monitoring groundwater wells wouldn't be part of this study. But your question about Long Pond, that's a great question. So why wasn't Long Pond included in this study? So first, as a health department initiative, we're really focused on permitted bathing beaches where swimming and wading are the primary PFAS exposure pathways. And then the second reason is that the landfill is sampling in Long Pond, and they have a slightly more complicated sampling scheme. They have multiple rounds of sampling. They have multiple sampling locations looking at different inlets along the Long Pond. And Bruce, I can refer you to our website. We have an FAQ where we do have the data from the Long Pond surface water sampling up.
Okay, thanks for your answer.
Thank you. Any other questions? Okay, Ann Troutman, I'm gonna allow you to unmute.
Hi, can you hear me okay?
Yes, I can.
You had mentioned that you did some sampling in Sconset and it came out, extraordinarily high during a day when there was algae on the beach. And you said that you went back and you sampled it again. Did you sample the algae those other 2 times?
Dr. DeVries, do you want to take that one?
Sure, thanks for the question. And when we went back those 2 times, that red algae wasn't present, so we were able to get sort of a clean surface water sample in those cases. No, we did not sample the algae separately. That would
Thank you. Thank you. I asked
Yeah.
just because there's so often a lot of algae on the beach, and often all day long, and so people do go swimming in that algae-filled waters throughout the summer.
Yeah, thank you. And I think there would have to be some further study to understand if that result is something that was in the algae or if it's something that just really threw off the PFAS analysis. Algae and other other organic material can really complicate the laboratory analysis that's meant for surface water to have a pretty clean sample.
Thank you.
Sure.
Happy to take any other questions. All right, I see Jonah has his hand up. Jonah, I'm going to let you go ahead.
Hi, Andrew. Thanks. And thank you both. This has been a great presentation, Rebecca. I'm wondering, I'm also out in QuidNet and I'm part of the QuidNet Squam Association. And by the way, Andrew, we'll follow up on that follow-up testing question. I'm wondering if you have any guidance for us on how we should think about the sand along the pond. That foam, builds and then collects and kind of sits on the edge of the pond. The photograph you showed is a small amount by some standards. And then I guess it kind of dissipates into the sand. And so I guess I know you didn't test that, but I'm wondering if you have any thoughts or guidance for us on how to think about the sand. Thank you.
Dr. DeVries, Joan and I have actually talked about this a little bit in the past. If you want to take a crack at it, I'm curious what you think. And Joan, I'm happy to provide a response afterwards too.
Thank you for the question, Jonah. I don't have an answer offhand about what that might mean for sand. I do want to say when we collected those foam samples, we tried really hard not to collect the sand with
Yeah.
it, but surely there was some of that in the sample too. So I just want to make sure that you're aware of that. Again, we tried hard, but there is organic material that came along with the foam. It's all kind of blown around in the foam. Specifically for the sand that foam is sitting on, I don't have an answer for you offhand. I can look around a little bit and follow up with Andrew, and maybe we can have a little more discussion on that. I can't answer that right now.
Thank you.
Yeah, Joan, I appreciate the question. It's a good one, and honestly, something we didn't think about going into the study. So I might need to get back to you for more details.
I'm expressing it as a concern of many of our residents, and I think it
Yeah.
just sort of follows the logic. It's dissipating at the edge of the pond. And we and our pets and our boats and everybody is kind of traversing that. And so the foam advisory is a helpful statement, but I think it also leaves a certain question there.
Yeah. Thank you. Okay, I see a hand up from Mitch Blame. Mitch, I'm gonna allow you to unmute yourself.
I think did that work?
Yes, we can hear you.
Okay, thank you, Andrew and Dr. DeVries for the whole program and presentation. I did have an observation and also a question. Living in the Upper Harbor, I noticed quite often during the summertime that there were substantial amounts of foam along the beaches in Pocomo and the Upper Harbor, and see that no samples were taken from that area, understanding the limits of time and the necessity of the study. But I think that being an enclosed body of water certainly should be something that would be taken into consideration for a newer study. And one thing about the foam, understanding that it's a relatively new field of the study, that as that foam collapses, the concentrations, as was noted by Jonah previously, are collecting probably in the sand, but they would also, with the tides coming in and out, would be reinserted and absorbed into the water. So I'm wondering how that could be incorporated into the study to find out what may be, in fact, quite different levels of PFAS. The other question that I have is there any intent or has there been any sampling of the fauna of the benthic population, which would be really important to everyone who uses the waters, especially in the harbor? Thank you.
Yeah, thank you, Mitch. I can take kind of questions 1 and 3. So first, we aren't able to collect foam from every beach. I understand it does accumulate somewhat frequently off of Pocomo. But that being said, the advisory that we issued, even though we sampled at only 2 beaches, it does apply to other beaches around the island. So even in the absence of data, we are able to say that we recommend avoiding contact with that foam. And then going back to your other question, about fauna. It's a great question. It's something we're thinking about. It's certainly something that I am interested in studying. It's nice to hear that there is interest in the community as well. Um, and then the other question was what happens to the PFAS that's in the foam once it dissipates, perhaps back into the surface water. Dr. DeVries, do you want to take that one?
Yeah, sure. I can take that. I think the short answer is we don't know for sure. The foam doesn't permanently remove PFAS from the water. It can break down and then mix back into the surface water. Um, I don't think we have data from this study to show evidence that that process is like meaningfully increasing PFAS concentrations into the surface water. I think it's something that would have to be studied more. We did collect the foam samples and the surface water samples at the same time, and we did try to collect the surface water in close proximity or in proximity to where we collected the foam. So along Sachaca Pond, we collected the foam that was on the shoreline and then just stepped a little bit out into the water and collected the surface water sample. So we're not seeing it that way, but when that foam goes back into the surface water, I do see your question, and it's something that I don't have a direct answer to, but surely it can break down and mix back into the surface water, I think.
Okay, I see another hand up from Mary Beck. Mary, I think you can go ahead and
Yes.
speak.
Thank you also to both of you for a very enlightened hour. But I was wondering if we could get a very short tutorial from either one of you on what creates the aquifer. In other words, does Nantucket, is it one lens that you hear about that is a single aquifer on the island? Or is the island composed of a multitude of different aquifers depending where you're related to on your part of the island? How does that work? And does surface water infiltrate eventually the aquifer, or are they separate entities?
Sure, I can take a crack at that one. So Nantucket is a sole source aquifer, so the only source of drinking water is the water that everyone lives on top of. And so there is a aquifer below, and then might get the depth wrong, but about 100 feet down, there's a confining layer, and then there's a separate layer of the aquifer below that. And then even down further, like, I don't know, 1,000 feet or something like that, there's another semi-confining layer and then another layer of the aquifer. So, some people think of it as one aquifer. It's designated as a sole source aquifer, but there are a few different layers of it. And then, if you have an impact somewhere, where the water flows, it does follow a particular pattern. So, generally it flows from an area of high groundwater elevation to low groundwater elevation. And that generally follows the topography of the land. So in the middle of the island, it's higher up. The groundwater depth generally flows from there down towards the ocean. And then surface water bodies, those are low points on the island generally. And so they can receive water from the aquifer, but they most likely don't flow back into the aquifer. I hope that helps.
So typically, how deep are individual wells drilled? Does it vary depending on, or do they go to mainly one level of depth?
It's mostly in the upper level. If
Okay.
you're thinking about your own particular well, you would probably have to go back to the engineering drawings. But typically, I see wells dug at 60-ish feet. You know, I see wells dug at 30 feet too, but you know, in that range.
Okay, but they don't go down to those lower 1,000 feet depth, typically not.
Some of the public drinking water wells go into that second layer.
Okay, okay. Thank you.
No problem. Bruce, I see you have your hand up again. Would you like to go ahead?
Yes, can you unmute me?
We can hear you.
Oh, thank you. From Mary's point, the Board of Health has the plans of your well and how deep it goes, and they have that for almost every drinking water well on the island. I just wanted to thank you very, very much for this very important presentation. It's been very helpful. And I have two quick questions, not very deep. One, will these slides be made available for us? And two, will there be a transcript of this session that we can participate in?
Yes, these slides will be available. As for the transcript, I will get back to Nantucket TV and we'll find that out for you.
Thank you so much.
Any other questions? All right, well, seeing no more hands, I'm going to say that we can wrap it up. Thank you to everyone who attended. You have my email on this last slide, so feel free to reach out if you have any questions. The sampling and analysis plan and the final report are on our website. If you Google Nantucket surface water PFAS, you will likely find it. Also, Dr. DeVries has our general PFAS website up here. So thank you very much, and thank you, Dr. DeVries, for the great presentation. I think we're going to wrap it up. Thank you, everyone.
Thank you.
Bye.
Thank you.